When I think of the subject of induction of labor, I divided my brain into two groups. There are inductions of labor for medical necessity because something's wrong with a pregnancy and we need to get that baby out of that mother. The other type of induction of labor is elective induction for convenience. There's a lot of misinformation about induction of labor for convenience, and I would like to try to address it. The first thing we have to stop and think about is, what are the risks? What are the risks to the mama? What are the risks to the baby? And the answer is, there really aren't any under certain circumstances. You take 1,000 women that have their labor induced, compared to 1,000 women that have natural labor. What's the C-section rate? What's the hemorrhage transfusion rate? What's the length of labor rate? What are any other problems that could occur, like infection? And the answer is, the statistics are equal. There's no increased risk with elective induction. So then we do the same method with babies. You take 1,000 babies that have been induced, compare them to 1,000 babies that have had natural labor. How many of these babies go to the intensive care unit? What is their infection rate? What is their jaundice rate? How many visits to the pediatrician do they have in the newborn period? They even follow these babies into elementary school and see how the babies do in school. And you know what they found when they compared the two groups? No difference. So that's why we can say to women, there is no downside to elective induction. So what's the upside? There's a bunch. You got job organized, you got your family support group organized, you can pretty reliably have your doctor there rather than the on-call doctor. You've got the day shift of nurses, there's more of them and more experience. You've got a fresh anesthesiologist if you want an epidural. You've got the baby a little bit smaller, pediatrician nearby. We can handle labor 24 hours a day, 7 days a week, of course. But by doing an elective induction, it sort of stacks the cards in your favor to make things go smoother. One of the little misinformation facts about induction of labor is that by inducing increases the risk of C-section. It's true, if you put the medically necessary group with the elective group, there's a higher C-section rate. But it's not because of the elective group, it's because of the medically necessary group. And of course, they have, by definition, high risk pregnancy, so they've got a higher C-section rate. So you got to be clear about that important point.